And soft open here. Good morning, everybody. Welcome to the webinar. Had a couple little technical glitches here because I'm trying to do this on a laptop, and I finally figured out the sound. So Jeff Beglin here from Cornerstone. Today we're joined by Ryan Black, Jim Derrick. Ryan Black is from CareSource, and he's going to discuss the 2026 individual health insurance product updates and some housekeeping. And I'm going to ask all of you if you could go into your question box and just confirm that you hear me loud and clear and everything's coming through properly. And that's a big help to me to make sure all this new technology is working. And if you have a question, put it in the question box. We'll monitor these throughout the presentation. I'll jump in at various points and ask questions. We can also wait to the end of the presentation. So you'll get your questions answered. And connect with us, follow us on social media, and subscribe to our weekly Monday Minute newsletter for the latest Cornerstone carrier and industry updates. And again, here I am, Jeff Beglin. New title is Business Development Manager. So, and my colleague, Carla Winfrey, she's great. She's sort of the back office specialist, all things individual. She tackles a lot of the issues in terms of billing, some customer issues. She looks at different delinquency reports and also some reports that come over on Health Sherpa. So we're so delighted that she's helping out in that capacity. And if you guys wouldn't mind, I'm going to look at the question box. If you guys could, okay. And just verify that you can hear me loud and clear. Okay. Thank you, Michelle. Thanks, Gary. Stacy, fantastic. Love it. I love it. Okay. And okay. Thanks, Gary. Okay. Without further ado, I will toss things to Ryan Black of CareSource. Take it away,
Awesome.
Ryan.
Thank you. I'm going to go ahead and share my screen. Can everyone here see it?
Let's go in here.
You should be able to see that first slide right now.
Yeah,
Jim,
okay. So, yeah, Aaron says yes. Harry says yes. Great. Okay.
Okay, cool. So I'm going to go off camera just to make sure that there are no delays and switching to the slide with the bandwidth, but just wanted to get my face out there and say hi to y'all. So everyone here is going to be familiar with CareSource. I do want to give you a couple quick updates though. You've all seen these slides a billion times, but I want to talk about the service area. You all know we're a nonprofit, been around 30 years, all that good stuff. What I want to focus on is we're currently serving 2 million members in Arkansas, Georgia, Indiana, Michigan, Mississippi, Nevada, North Carolina, Ohio, West Virginia, and Wisconsin. There are going to be some changes for 2026. So currently we have marketplace plans in North Carolina, in Kentucky, and in Michigan. We are pulling out of all 3 of those markets. So the Kentucky news is old news. North Carolina, that decision was made last month. And then Michigan, we were in there with HAP CareSource. We are pulling out of the marketplace there. There will still be some HAP CareSource plans there outside of marketplace on the Medicaid side of things. But as far as agents are concerned, Michigan, Kentucky, North Carolina are no more. We are adding Nevada. We are statewide. That's pretty much just good to know because the thing about Nevada is you have to be a resident licensed to sell there. It's the only state I'm aware of that has that rule, but you have to have a resident licensee to sell there. They're really protective of their Nevada agents. That rule came in 2020. I'm assuming it had something to do with COVID. If you had a license in Nevada pre-2020, you are grandfathered in and you can still sell there. Most agents I've come across are not in that situation though. We are expanding to Ohio. In Ohio, we had 86 counties. Now we have all 88. West Virginia, we're still statewide, and we have added Wisconsin. I'm sure some of you know that. They used to go under Common Ground. They are switching to that CareSource branding. So that's just that. We're also expanding in Georgia everywhere. So that is just the service area update there. Again, life service or our nonprofit mission is essentially focusing on things outside of the product. So life services helps with job training, helps with life coaching, helps with transitioning out of incarceration if it's one of your clients is in that situation. We provide flows for interviews, interview training and coaching. And this is available to all marketplace members in the state of Ohio at $0 cost to the member. If you want some more information and in depth on that, you can go to our website and enroll your member there. It's also not just available to the marketplace member. Let's say I'm a marketplace member in Ohio and my wife is not. She has access to this as long as the person lives under the household of the marketplace member. That whole household is entitled to these life changes benefit. So that's super cool. Kind of the difference because we have to make sure that 90-something% of the revenue that comes in goes back to our members to maintain our nonprofit status. And this is one of those programs that allow us to do that. My Life app, this slide's kind of just random and falls in here, but super important. Make sure all of your clients download the My Life app. Why is this? Well, first of all, the broker or the member ID cards can take a week or two to mail sometimes, depending on when they enroll. Having this My Life app will ensure that they have their application right at the time of enrollment. So that's great. You can select and change your PCP on here, request a new physical member ID card, view your plans. Anything that all health insurance apps do, you can do through the CareSource My Life app. So highly recommend every single person or every member that has access to a phone with applications, download that app. It'll make their life easier, which makes your life easier, which makes Jim's life easier and my life easier. Everybody wins. Okay, moving on to health insurance marketplace. So before I dive into CareSource, I just want to talk about the market as a whole real quick. There is a lot going on. Nothing more important than those extended subsidies are scheduled to go away. Now, if you were on this call earlier, you heard Jeff and I kind of talking about what's going to happen to this. The government is currently shut down and, and one of the sticking points of the shutdown is one political party would like to bring back these subsidies while the other political party seems to not want to do that to end the shutdown. What CareSource's lobbyists are telling us and our folks on Capitol Hill are telling us is do not count on those subsidies coming back. I don't think they're going to come back, at least not in time for open enrollment. I wouldn't count on those. Another caveat to that is even if they come back, while yes, that would be helpful for the marketplace, it's not going to change the fact that all the carriers' rates are set as if those subsidies don't exist. So what does that mean? With the extended subsidies going away from the carrier lens, the carrier is expecting that those healthy folks will either find alternative healthcare through short-term plans, through church plans, etc., or just opt to not have health insurance because a healthy 30-year-old might not be willing to pay the big amounts of premiums without having that subsidy. So from the carrier's thought process is the only folks, not the only, but the great majority of folks who are going to be enrolling in an ACA plan are going to have a lot of doctor's visits, a lot of medications, a lot of procedures, a lot of claims that the carrier is going to have to pay out. So what you have seen is something I have never seen in my life. Everyone filed their rates in like June when their normal filings happened, and everyone was filing with like bigger rate increases than normal, but nothing too crazy, like 11 or 12%. And then one carrier, who I'm not going to call out, filed pretty much across the state with rate hikes between 30 and 120%. All the other carriers saw that and then reached out to their respective states, ODI, or for Ohio, for example, it's ODI, but reached out to their respective states' departments of insurance and requested that they refile. Basically, all the other carriers were like, what does this one carrier know that we don't know? and then everyone hiked their rates up. So that's kind of how that started. So rates are going to be quite a bit higher this year. Obviously, the out of pocket that the individual pays will depend on their subsidy. It is worth noting that subsidies still exist. It's just going to that pre-COVID level era subsidy. So that's kind of the situation right now. There are bright spots to the ACA changes, though, and I'm going to talk about that here coming up. Make sure if you have any questions about that, again, you drop that in the chat, because I think what's happening right now in the ACA is quite fascinating just from a curiosity standpoint. It's sad in some places and really good in some places. So moving on. CareSource, like I said, we are now officially statewide. We've basically been statewide since we've been in Ohio, but we finally added Knox and Athens County, so we can service all 5 people who live in those counties. I'm kidding. The population's bigger than 5, but small places, but we added them, which is super exciting. Here are our bronze plans. But I know everyone's already looking ahead at the cost share. So before you do that, keep in mind what's in parentheses. This shows where the plans are available. So in Ohio, you have the bronze 7500 and the low premium bronze. I'm going to start with the bronze 7500, just go left to right, and I'm going to do that on all of these slides. So the bronze 7500 is our bronze first name. Why did our product team decide to change the name of our most popular plan? I have no idea. When I found out about that, I reached out and complained, but I'm not in charge of the branding of our plan name. So bronze 7500 is essentially that bronze first plan. Here are the cost shares. It is the federal standard plan. This core bronze plan is just in our state-based exchanges, and it's basically the same exact plan. It's just we can't use federal standard plans and state-based exchanges, so we just switched the name. Low premium bronze. So CareSource is doing quite a few different things to try to ensure that everyone has an affordable insurance option. This is one of those things. We have added a low premium bronze plan to all of our markets except Wisconsin. The low premium bronze plan, as you can see, very high deductible, very high out-of-pocket max, and no first dollar coverage until that's met, besides that $25 tier 1 drugs. It's essentially a catastrophic plan. But what it does is it provides an ACA qualified health plan to individuals who might be healthier, might not have a lot of claims, and just want something in case, God forbid, they get in a car accident or they get a cancer diagnosis or something. They are covered. So I think this plan is going to be a big deal this year. I think it's going to help out a lot of those folks who are losing their subsidies and don't want to pay that high premiums. What you'll see over here is an HSA eligible plan, just in Georgia and Indiana. I don't think this plan is going to exist after this year in those 2 states, because one of the other bright spots of ACA changes, all bronze plans are now HSA eligible, which is super cool. Previously, HSA plans were pretty much deductible and max out of pocket were somewhat lower, but there was $0 coverage until you hit those. That has changed now. Now, every single bronze plan across the whole entire country is HSA eligible, which means you can pay for your cost shares and your copays with your HSA. So that is a super exciting thing. CareSource is also investing heavily in our off-exchange plans. So what you see here are all available on and off exchange. The plans, like the bronze 7500, will be available off exchange, and then there's going to be 3 other plans that are available off exchange. I thought I had that slide in here. I did not. I will send that out to Jim after this to die down. But essentially, there's 3 off exchange only plans on the silver and the gold medal levels, and they will be running about 10 to 15% cheaper than what you're going to see on exchange. I'm pretty sure. Yes, I have those slides just out of order. So we'll talk about that soon. Moving on to our silver plans. Silver 6000 is the federal standard plan. Please note, in rating areas 1 and 11, this is going to be in the Toledo area and the Cleveland area. This is the only silver plan that we're going to be offering there. So everything else that you see Ohio on is Ohio, everywhere in Ohio except rating area 1 and 11, which is that Cleveland area plan. So Silver 6000, only available in rating areas 1 and 11. It's the federal standard plan. In Ohio, we are also adding our chronic condition plans, which is going to be our HDHP, our diabetic silver, and our healthy heart. Again, not in 1 and 11, but everywhere else. Those plans have improved a lot. So 3 years ago, we introduced the diabetic plan, and it had a okay inaugural year, but we got a lot of feedback from the brokers, and we were able to adjust and tweak it. Some of that feedback was the specialist copay was way too high. We had this specialist copay at $80 when we came out. Feedback from the brokers were if these folks are on a diabetic plan, they're more than likely going to their specialist quite a bit, and they don't want to be paying $80 every time they go see a specialist. So we tweaked some things and we got that down to 50 to kind of match where what you would see, actually lower than what you see on other silver plans that aren't focused on chronic conditions. We also got some feedback that the prior authorization requirements for the diabetic drugs were too strict, for lack of a better word. So we dialed those back as well to being what CMS requires and nothing more than that. So that is great. And you're going to see what those diabetic benefits are in a couple of slides, but that plan has done really well. It's worth noting that that's not going to be our cheapest silver plan. It's going to be a little bit of a premium on the diabetic and the healthy heart plan. Looking at this HDHP, high deductible health plan, this is our only HSA available plan on the silver metal level. So if you got someone who wants to use their HSA, got a lot of money in the HSA, then doesn't want to pay any cost shares or whatever with normal pocket cash, they can use their HSA on that. So those off exchange only plans I was talking about, all of our on exchange plans are also available off exchange. They're going to be essentially the same price, except about 2% cheaper just because you don't have to pay the on exchange fee. That said, we are adding off exchange only plans on the silver area. So the low deductible silver, the HDHP preventative silver, and the silver 5100 are available off exchange only in Georgia, Indiana, and Ohio. These plans will be about 10 to 15% cheaper than what you see on exchange. This is another thing that CareSource is doing, trying to find a way to save those folks who are losing their subsidies and are no longer subsidy eligible. As you all know, off exchange plans aren't eligible for subsidies. So it's not for everyone. There's going to be folks who still are getting subsidies, even with the extended ones going away. These plans are going to be great for anyone who's not subsidy eligible on the marketplace moving forward after their expiring of those extended subsidies. So always worth looking at this. Previous years, you had paper applications for off exchange. That's no longer the case. All of these plans will be available on Health Sherpa. Just make sure you look for that off exchange tab in the plan name. So it'll be in the plan name, and you can also filter by off exchange. You guys know Health Sherpa better than me, but play around with that. Definitely worth looking at. Moving on to gold.
Ryan?
I know not.
Well,
Yes, sir.
Hey, Ryan, can I jump in real quick while we're still on these silver plans and some other things? We have some questions that jumped in. So first of all, why are diabetes and heart healthy plans leaving areas 1 and 11?
Yeah, so we're actually pulling out all of our silver plans besides that federal standard plan. Now, it'll still be available on the gold level there. To be quite honest with you, in rating areas 1 and 11, from the carrier's perspective, we're not competitive. We're losing a lot of money. This is a way to protect the company, especially on those silver drugs, on those chronic conditions. So that's a way that we can still stay in the rating areas 1 and 11 while limiting the risk to CareSource. So they made the decision to pull out all the silver plans except for that silver standard.
As the state remains with those plan options.
Correct. And besides
And
the Toledo and Cleveland area, those
okay.
plan options are in the rest of the state.
And how many counties are affected? Because
And rating areas
obviously,
1 and 11?
yeah,
Off the top of my head, I don't know that. But I haven't counted the counties, but I mean, you can just Google ACA rating areas, Ohio, and then
Okay.
you can count them up for you. But it's going to be mainly around that Cleveland and Toledo area.
would that include
There are,
Akron? Would that include Akron, do you think?
again, off the top of my head, I don't know. I actually don't think it does include Akron, but don't quote me on that. There's 17
Okay.
rating areas in Ohio for context. So this is affecting 2 out of the 17 rating areas in Ohio.
Okay. And there's another question about network, but I think you'll get to that in a little bit. And let me just see if there's anything more regarding the rating area. Will they cover, okay, oh my goodness. So will they cover pre-existing conditions,
All ACA plans are required by law to cover pre-existing conditions.
even if there's diabetes already
Yes.
diagnosed, et cetera? What
Yeah, on
happens to members?
exchange and off exchange, every ACA plan by every carrier has to cover pre-existing conditions. There's no underwriting.
What happens to members in Northern Ohio who are currently on the diabetes and chronic plans? Will CareSource crosswalk them?
They can be crosswalk, but I would recommend to agents that they sit down with those clients and look at either going to that silver 6,000 option, look at possibly upgrading to a gold plan, which I know most people aren't going to do, or look at switching carriers. I know Oscar has a diabetic plan available in the area. I'm not sure how good it is, but it definitely might be worth switching carriers at that point.
Okay. And I think we got one more question. So okay, this is related to off exchange. So if we don't use Health Sherpa, we can't write off exchange plans? That's a
No,
good
you
question.
definitely can. You definitely can. So you can, what enrollment portal are you using? Or are you doing paper
Well, let's
application?
just say cloud in this
Okay,
case.
yeah. So it's on Health Sherpa now. I can get an update on if it's on cloud and give that answer to Jim
Okay.
later in the day. I'm not sure about that,
Yeah.
but we do have paper applications as well that you can fill out. So
Okay.
yes, those are available. And Jeff, I am not getting into network, so if you want to ask that network question, feel free to.
Oh, okay. Yeah. So, well, the question just categorically is, has the network choices improved? Um, I'm not a network person either, so and
So
I've
yeah,
always thought they've had a good network, to be truthful.
I can
So
answer that. So last
yeah.
year we kind of revamped our network for plan year 2025 and we added a lot. Ohio Health being one of those. That was the big improvement for us was last
Okay.
year. This year we're pretty much maintaining that network from last year. The reason we didn't add to it was one, we're by far the strongest network in the state. The only thing that we don't have is the Cleveland Clinic, but the only ACA carrier that does have the Cleveland Clinic is Oscar, and their rates in that area are exorbitant because of that. So that's not a big differentiator for CareSource. So our network across the state is by far the best. The reason we're not adding to that is because if you ask me, I think our network is too good and it's impacting our premium price a lot. And this year, we're doing everything we can to try and keep our premium price down. Now, we haven't canceled contracts. We haven't done anything like that. We're maintaining essentially the same network. We might have a additional PCP here and we might lose a PCP here, but essentially it's going to be the same network, same hospital systems. Still have Nationwide's children, still have Cincinnati's children, still have Ohio Health, OSU, and all of that good stuff. So
Back to the
yes, very
Columbus
strong
broker.
network.
Columbus is, if I could just jump in here, I think everybody in Columbus on this call should take note because that has been a real challenge getting somebody, getting a carrier that offers both Ohio Health and OSU.
But we're the only ones that do it, at least for plan year 2025. I don't want to speak for what's coming up next. And I
Okay.
believe we're also the only carrier that has Nationwide Children's in network. Now, what comes with that? Higher premiums. I don't think we're the most expensive, but we're up there in the Columbus area. We cost a pretty penny in the Columbus area. We're not super competitive premium wise because our network is so big.
Okay,
So
but
that
yeah,
that's worth looking into your calculation.
but every indication is the networks will stay the same, right?
Yeah, essential. Not like obviously it's never the exact same, and the doctor can pull out at any moment. But the hospital systems are staying the same,
Okay.
and we're not looking to actively term contracts or worsen our network. We're just
Yeah.
not looking to build it right now.
Just stay tuned, everybody. That's right.
Yes.
Okay. My disclaimer, just stay tuned. Okay, let's roll on. Gold.
Cool. All right. Gold plans. So we have that gold six. Oh, I clicked too fast. We have the gold 1600 in Indiana, Ohio, and West Virginia. We have the gold 1500 in Georgia and Ohio. A low premium gold only in Georgia and Nevada. So those are our state-based exchanges that we are in. And then we have the diabetes and healthy heart plan that you saw available on a silver level, also available on the gold level. Only difference between those is going to be the cost shares are different, but they get the same $0 benefits that I'm going to go to in a few slides. And then we have some off exchange only plans. I will say, and I don't know how much this group does any ICRA, but these plans last year sold pretty heavy on the ICRA side of things. I don't see them selling much on the individual side of things, but definitely worth noting if you have any ICRA interest. But off exchange, we have that core gold and the HDHP. Now, this core gold, again, is going to be about 10 to 15% cheaper, depending on what county you're selling this plan in, than the core, or the gold 1600 here. So it is cheaper to do that. So again, great for someone who has no subsidies at all. And the HDHP plan is HSA eligible on the gold, just like it is on the silver. So those are some good things happening there. Now, the chronic condition plans. Why is the diabetes plan called the diabetes plan? Well, because everything that you see on the screen is at $0 to the member if they meet those prior auth requirements. Now, if you remember earlier, I said the first year we launched this plan, the feedback was our prior auth requirements are way too strict. So we lessened those a lot for last year. And I have not gotten a single complaint last year. Well, I guess for this year, technically, for plan year 2025, I haven't got a single complaint about our prior auth requirements being too strict. The big thing that's probably you're going to see that's sticking out to you is Jardiance. We all know how expensive Jardiance is. If they're enrolled in this plan and if they meet that prior auth requirement, which is having that diabetes, diabetic diagnosis, Jardiance becomes available to them at $0. We also have a whole bunch of generic drugs, but it's not just drugs. You get the self-management supplies like your CGMs, your glucose meters, your ketone strips, and insulin delivery pods. So really great benefits here. That's why you are going to see a little hike in premium, but it's a math equation, right? If you have a diabetic who is dependent on a lot of drugs and needs to take insulin 3 times a day, then yeah, this is probably going to be the best plan for them. They're going to save the money. But if you have a pre-diabetic who isn't on insulin, then they still might want to look at that bronze plan. So just because they're diabetic doesn't mean this is the best plan for them, but it is a great option for diabetics to look into. Also worth noting that you don't have to be a diabetic or have that diagnosis to enroll in the diabetes silver plan. In fact, we have about 30% of folks who are on this plan right now who aren't diabetic. And they just like the low cost shares and the lower deductible than the rest of the silver. Going back to that earlier question about will we protect pre-existing conditions, that's part of it. Part of the pre-existing conditions is every carrier in the country has to protect pre-existing conditions, and that means no underwriting on the ACA. Because there is no underwriting on the ACA, CareSource can't say that you have to have an XYZ diagnosis to enroll in XYZ plan. All plans are open to everybody, regardless of any diagnosis. So those are the diabetic benefits. Healthy heart plan, very similar to the diabetes plan. You even still get Jardiance at $0, and then you also get Entresto at $0. The big difference between the healthy heart and the diabetic plan is going to be the supplies and also the drugs. You're getting drugs for heart conditions, not for diabetic. Some of those overlap, like Jardiance and Entresto, but that's just the nature of the human body. And then also the tests and the screenings are going to be for heart conditions versus those diabetic conditions. Again, great plan. Historically, with those HSA plans on the HDHP plan, you weren't allowed, CMS didn't let you cover anything until you hit that deductible and that max out pocket. That has changed in 2 cents. One, that has changed on the bronze side. As we all know now, all bronze plans are HSA eligible, which is great. And 2, they allow exceptions on the silver and gold side for covering things before that out-of-pocket max and that deductible is hit. As long as that coverage is targeting chronic conditions, CMS has this big emphasis on trying to lessen a lot of these chronic conditions in the country. They've had this going back a few administrations now, and this is part of that. So what we did was we pretty much, and it's not the exact same, but it's pretty close. We pretty much took all the $0 benefits available on the diabetic plan, all the $0 benefits available on the Healthy Heart Plan, and we combined them because why not? So those are all available. Everything that you see on your screen here is available to at the member and the HDHP plan at $0. Again, the high deductible health plan is also HSA eligible on a silver and gold side. It's the only silver and gold plan that we have that is HSA eligible. So that is great. Before I dive into the additional plan details, I want to take a moment to see if anyone had any questions on those chronic conditions. I know it's a lot of information. Jeff, did you see anything in the chat?
We've had a lot of questions come in. Will CareSource crosswalk the existing members, or do agents have to do that on these chronic conditions?
In rating areas 1 and 11, I would highly, highly recommend that agents manually do that because I don't know if the crosswalk plan will be right. Outside of that, I believe the answer is we will crosswalk them if there is no action on your part, but I'm going to verify that and I'll get back to Jim on that later this afternoon.
This is somewhat related. Which silver plan was HSA eligible?
The HDHP plan. So that is going to be right here. HDHP plan. This one right here is HSA eligible.
Okay.
And it's also off exchange version is also HSA eligible.
Cool. And off exchange has no underwriting as well. That's right.
That is
off
right.
exchange plans, guarantee issue, no difference.
So even though their off exchange has it sounds like it's like a fake ACA plan almost. Because it doesn't, it's not subsidy eligible. I've heard that before. It's not. It is a qualified health plan and it follows every single ACA regulation. So there is no underwriting on that. All carriers are still required to protect pre-existing conditions. It's essentially the same exact thing, with the only difference being no subsidies, which gives the carrier flexibility on lowering the premium.
Yeah, it's great for customers who don't want to just have to go through all the additional questions associated with a non-exchange plan. Are all bronze plans HSA compatible on and off exchange? Good question, Ben.
Yes.
Off exchange HSA.
Yep, and that was part of the that was introduced in the Big Beautiful Bill.
Okay. I also have that question from another agent. Okay. Okay. Well, a question about traveling outside of the country. Not all the questions are loading properly for me, but there's a question about traveling outside of the country. Will ER be covered?
My understanding is if you're on an ACA plan, you're not covered outside the country for emergencies, and I would be recommended to get a travel insurance.
Okay. Now, how about traveling inside the country but out of Ohio? How's that covered?
Yeah. So the way CareSource's network works is our prescription or pharmacy network is nationwide. Our fitness benefits nationwide, and our vision benefit is nationwide. Our doctor benefit or standard medical is not statewide. So you will be covered in emergencies anywhere in the country per law. That's every ACA plan and every carrier. But you will not be covered. Like, I can't go see a PCP in Kansas if I'm an Ohio Marketplace member. Our networks are only statewide. That being said, there's crossover. If you live in Cincinnati, we have doctors who are located in Kentucky that are part of the Ohio Marketplace network. We also have providers in Indiana and Pennsylvania who are part of that Ohio Marketplace network. It goes out about 30 to 40, 50 miles or so. But
well, let me clarify something. Since you've exited Kentucky, I don't know that someone in Kentucky can access Ohio.
Well, I can't speak for other carriers. What I can know is a Kentucky Marketplace member who chose the real sad thing about us leaving Kentucky was we were the only Kentucky Marketplace carrier that had Children's Hospital or Cincinnati Children's Hospital on network.
Yeah.
We are leaving. which I
Yes.
think means that there's no Kentucky Marketplace plan that has Cincinnati
Right.
Children's in the network anymore.
You never
I
know.
don't
Somebody,
know if someone's going to
yeah,
pick that up or not. I really hope someone does. But yeah,
yeah.
Kentucky Marketplace I mean, starting 1/1/2026 will not be a CareSource market. And we cannot re-enter Kentucky for at least 5 years. So that's not going to be happening anytime soon.
Okay. Okay. Thanks for the clarification. More questions. Can the member be actively contributing to the HSA when buying an HSA HDHP plan?
Yes.
Okay. They just have to currently have an HDHP plan. So, you
Yeah.
can't be contributing right now without one of those plans in place. So, I'm sorry, I'm gonna got a couple more questions.
No, you're good.
Um, what is the definition of an emergency?
The ACA defines that in the bill. Um, and then we have our claims team that will either approve or deny it. I will say CareSource's denial claim rates are much lower than industry status, but yeah, it can be hard to tell. The ACA though defines it in the bill, and I'm pretty sure it's life-threatening situation. But I would just go look at the Affordable Care Act and read the definition of emergency situation there. If I stub my toe, for example, it's not going to be an emergency. But if I'm
Right.
having a heart attack, that's an emergency. So there's
Yes.
a lot of back and forth in that. But we do cover all emergencies in the country.
We're caught up. Thanks, Ryan. Take it away.
Yep. I would like to add to that. I don't think we cover this is what I don't know if anyone's going to Puerto Rico. I'm pretty sure that those emergencies have to be in one of the 50 states or Washington, D.C. I don't think like the America Samoas or Puerto Rico counts for that. So just a crazy situation that might happen there. Doesn't extend to territories. All right. Teledoc. If you guys are familiar with Deft Research, Deft Research is a company that is the biggest health insurance research firm, and they research consumer behavior. And I was listening, and so is Jim Derrick with me, actually. We were listening to a Deft Research presentation at a CareSource event. And the biggest complaint, besides premium, which is the biggest complaint every year, was the cost of telehealth. And that kind of baffled me because I know CareSource offers telehealth at $0. And I didn't think that was going to be a differentiator between CareSource and our competition. And it turns out it wasn't during COVID, but it is now. Carriers are starting to start charging for telehealth. CareSource does not do that. We offer $0 telehealth through Teledoc. Has to be a Teledoc provider. I know we've had a lot of network questions, so I want to specify this. Has to be a Teledoc provider. Their provider network is huge. This is also nationwide. So since it's virtual health, you can have this appointment if you're in California. That's fine. But the Teledoc network is huge. And it has to be one of those providers, and you can see their network on their website. And I say this because some PCPs offer virtual health. My PCP offers virtual health. But if my PCP is in the Teledoc network and I set up a telehealth appointment with him, I will be billed at that PCP copay. So make sure it's a Teledoc provider. Historically, telehealth is typically that general medical or flu, allergies, and all that good stuff. CareSource has recently added behavioral health to this as well. This is super cool. So you can have therapy sessions for anxiety, depression, stress, substance use, and so on. Obviously, suicidal thoughts are a 911 call. These are non-emergency behavioral health stuff. This age restrictions that apply here, it's 18 years old. We don't offer that behavioral health for children. But yeah, that's a super great program. The cool thing about it too is if I'm seeing Dr. Jim for my first therapy session treating my anxiety, the next time they're going to ensure that I'm still seeing that same provider. So I don't have to retell my trauma story to every single provider to start the first 30 minutes of the therapy session. These are also unlimited. They are not capped at 20 visits per year. You can have as many telehealth appointments as you can handle throughout the year. Super cool benefit. Our utilization on this is not as high as I would like it to see. So please make sure that your clients are aware of this. It can save them a lot of time and money. All right. Non-essential health benefits. CareSource offers a vision and fitness benefit add-on. Last year, we got rid of dental. This used to say dental, vision, and fitness, and we got rid of dental for numerous reasons. The main reason was our dental plan sucked. The vendor that we were using, I'm not going to call them out, but their network online that they were showing wasn't accurate. So we had members who were going to dentists that they said were in network that weren't actually in network. Or we had dentists that were in network who weren't listing as in network. So that was a big problem. The second reason we got it was the cost. This used to say for around $12 to $15 per month because dental ate up most of that cost. Now it's between $3 and $6 per month. Vision is great and the fitness benefits great. I'm going to go into that here in a second, but that is why we got rid of dental. We tried to do a flex card that you'd see similar to on the Medicare side of things for dental, but CMS shut that down. We have no plans to bring dental back. We pulled a lot of our agents at random, and about 85% of them said that they don't want us to bring back their dental. They're happy with us just selling vision and fitness, and then they sell a standalone dental. And since we got rid of dental, our enhanced plans have actually sold much better. So we didn't do dental well in the marketplace. We listened to y'all. Y'all said get rid of it. The vision benefits. We use iMed. We use their network that's titled Insight. Amazing network. It's nationwide. These benefits haven't changed since I've been doing this because there's no reason for them to change. They're great benefits. You get your free glasses, free contacts. You get 40% off an additional pair. You can even get 20% off non-prescription sunglasses. You get 15% off LASIK and so on. It's great benefit. Agents never have any complaints about it. They all love it. So that's awesome. And then the fitness benefit. We utilize American Specialty Health's program called Active and Fit. Now, you've heard of Silver and Fit on the Medicare side. Active and Fit is what they do on the marketplace. Still that same parent company, American Specialty Health. They have over 13,000 gyms across the country. Big names. LA Fitness, Snap Fitness, Anytime Fitness, Planet Fitness. It's awesome. It's worth noting, though. Just because one Planet Fitness is a network doesn't mean that another Planet Fitness is a network. A lot of these places are independent franchises with different owners. So the best way to find out what gyms are in your network is you go to activeandfit.com, type in your zip code, and they'll pop up like chicken pox. If you see an inadequate amount of gyms in your area and you think there should be more, shoot me an email. You can go through Jim, shoot Jim an email. I have a contact at American Specialty Health, and they are great at adding gyms. There was a little area, kind of rural, about 30 minutes south of Toledo, and they only had like one gym within 10 miles. We reached out to American Specialty Health, and within 2 weeks, they had more gyms in them. Because the fact of the matter is, gyms want to be a part of American Specialty Health, and American Specialty Health wants to continue growing their network. So if you do see an inadequate amount of gyms, don't just accept that. Reach out to me. There's stuff that can be done. If you don't like going to the gym, you can choose one of these home fitness kits. They're available on the website, and they come with a Fitbit or a Garmin wearable device to track your steps and all that good stuff. I should mention that this is not an either or. You can get the home fitness kits and you can go to the gym. Also, if you go to a Planet Fitness one day, you can go to the Anytime Fitness the next day and LA Fitness the next day for their sauna. You don't have to pick one gym. Your member ID card is your pass into that gym if you have the enhanced plan here. Everyone knows how expensive gym memberships are. I go to Planet Fitness, it's $15 a month. This is only $3 to $6 a month, depending on what county you live in. It really is such an easy sale. So, any questions before I dive into just who our sales operations team is and who's here to support you, Jeff?
Okay, I don't think we've got anything. Well, we will be providing, the recording to everybody. Will you be providing a copy of the slides? Maybe we could submit those in the
of course.
editor. So we'll include that in the follow-up email to everybody. I think we're caught up. So folks, keep those questions coming, but we're caught up at the moment.
Cool. All right. I'll just go through real quick. So how we support you. On the D-SNP side of things, Mara Del Rio Cruz was in charge of our D-SNP broker sales. She's still at the company, but she's no longer in that position. We have hired someone since then named Mitch Flowers. A lot of you might know Mitch Flowers from
We love
United
Mitch.
Healthcare,
We
where
love
he was
Mitch.
the ACA rep. Yeah, I
We love
personally
Mitch.
stole him from UHC, and I'm stoked about it because he's great at what he does. So he is now on Team CareSource, which is awesome. You have myself, Mr. Cato, and then we report to our fearless leader, Krista Seaton, who's in charge of the account management team, as well as all the folks on here except Tammy, who's in charge of all of us, but on the sales support side of things. So these are the folks who are answering the phone call when you call that sales support line or you send them an email. They are incredible, especially Sharice Kirk. There's not a place or an event that I go to where someone doesn't pull me aside to say, tell Sharice I said thank you for this, or Sharice is a rock star, Sharice this, Sharice that. And I'm like, okay, but I'm pretty good too. But no one seems to care about that. They all care about Sharice. So Sharice, incredible. If you haven't had the pleasure of speaking to these folks, please give them a call. They are here to help you. We have also added a temp who is here that we're looking to get on full time as well. I think his name is Tom, Terry, or Tim. To me, those are all the same name. But yeah, so you could be talking about a fifth one as well. They're awesome. They handle your contracting, your onboarding, and any issues that you might be having with the broker portal. Whereas your broker account managers will handle any questions you have about the product, the network. If you have a member issue, if someone got a claim denied that you don't think should be denied and you want help escalating it, you reach out to us and we handle that for you. And that is my presentation. With that, do we have any questions? And I will stop sharing my screen.
Well, if I could just interject, we want to talk about Jim Derrick and Jim's role in this whole process. Jim's kind of our point person for our
Yeah,
Cornerstone
Jim's the man.
agents. Jim, do you got a second to
Yeah.
chime in?
Yeah, I'm here.
Yeah. So Jim does a fantastic job. All those things, that Ryan described there. Jim helps out in a million and one ways too. So
I get shy in large presentations, but I try to be very responsive. So
Yeah, I can. Jim, or Jeff, I can personally speak to Jim. Jim is my favorite FMO partner. He constantly goes to bat for his people. He utilizes all the resources I provide to FMOs. He's amazing with communication. He comes to all of our events to learn about the product so he can downstream that. You guys truly do have a one of a kind in Jim, and I really appreciate you, Jim, working to set this up so we can spread the good word.
he's your concierge resource for Cornerstone brokers. So we love Jim. And be sure to reach out to him if you have any questions, or reach out to me.
Absolutely.
We'll get Jim involved. Things get done. That's the bottom line. Things get done. So let's dive into some questions here and let's see what's come up. If I figure out how this thing works. All righty. Okay, it's kind of slow to load. Okay. CareSource sales support is the best.
Hey,
straight.
nice. I
Darn
like
straight.
that. I'm gonna shoot.
Yes. When will quoting be available for off exchange? Groups that currently have ICRA coverage are on an earlier time frame for renewals than the individual market.
Yes. So on Health Sherpa, our off exchange plans are already showing as of 2 Fridays ago. Yes, ICRA folks do have earlier access to those plans. Let me get that answer for that exact date and get that back to Jim. For some reason, I feel like it's live now, but I don't want to specify that 100%. So I will get that and get that to Jim so he can stream down.
Next question, where can we access updated marketing materials?
On PrintSource. They will be available for prints on PrintSource. They will to be ordered for hard copies, and they're also going to be available on our website in a digital format. If you go to caresource.com, there's a producers tab up top, and then right under that is marketing materials. Those will not be available until the shopping period starts. CMS can technically kick that off starting 10/15. Last year, I think it was October 23rd, they kicked that off. So we're gonna be waiting on that for the shopping period. The problem is they don't tell you when the shopping period starts. We literally wake up in the morning and they just send us an email saying it has begun, and then we turn everything on. So that's how that process goes. It's worth noting that the government is shut down now, and I don't know if the person who does turn on that shopping period is currently working or not. So hopefully there's no delays in that, but I would expect the shopping period to start between October 20th and October 25th, and that's when you'll see all those materials available.
If history's any indication, that's the time frame, generally a week before Halloween.
Yeah.
Just a quick question. What is PrintSource? Can you touched on that? I'm not sure what that is.
Yes. So if you need access to PrintSource, you can email our sales support team. PrintSource is essentially like an matter of fact, I can pull it up and I'll share my screen. It's essentially like an Amazon site. So you can go in and you can order all of your materials, which is super neat. So let me pull up PrintSource on my computer and then you can just kind of see. Is loading. So this is PrintSource. So when you're here, this is our order system. So you go to catalog, you can browse by state. So if you wanted some Ohio pre-member marketplace materials, you go to Ohio, marketplace, and brokers will be looking for pre-member materials. And then you would click pre-member, and then it takes you to all of our good stuff. And it turns out that some of these are already available right now. So our 2026 brochure, and if I wanted to add to cart, the quantity is not available. They just have the thumbprints. I was gonna say they shouldn't be available until the shopping period starts. But you just go here and then you put how many you want. If you want 50, and then you add to cart and you go from there. So yeah, this is PrintSource. This is what it is. If you should be able to have access to this, email sales support and ask them for access to PrintSource.
Good question, Ryan. How much will they pay to use PrintSource?
How much will the agents pay? No,
Yes.
no cost. No cost.
Free.
There is no cost. Yes, we do have limits on how much you can order. So you can't order 20,000 Ohio Marketplace brochures. That's not going to work, but you can get probably 100 brochures here and there. Definitely for sure. $0 cost you.
Okay, next question. I've worked with Vince several times and he is great as well. Thanks for that shout out.
Hey, Vince, nice. I'll give Vinny a shout out.
What about renewal information for current CareSource members? When will that be on the broker portal?
That is a good question. I will get that information and get it to Jim as well. And then Jeff, before this call ends, I'm going to recap all my takeaways, by the way.
Go ahead. I think we're at a lull. We don't have any questions, so go ahead.
Okay, so what I need to do is find out, is Off Exchange available on the cloud platform? Will folks in the diabetic plan crosswalk into the same or the diabetic plan again? And then in rating areas 1 and 11, will those people crosswalk to just the silver standard? When will off exchange quoting be available, since those ICHRA folks have earlier access to that? And when will renewal info be available? And then I also get to shout out Vince and Charisse and the sales support team for doing awesome. Those are my takeaways. Correct, Jeff?
That's what I see. Yes.
Awesome. I am traveling immediately after this, but I will get that to Jim tomorrow. Jeff, I will send you the hard copy of the presentation before I hit the road. So
That's
you
great.
have that to send out.
Okay, let's see if we've got any more questions, guys. I think that's it, everybody. Fantastic job, Ryan. Thanks so much, Jim.
Thanks, everyone. Thank you, Jim. Thank you, Jeff.
Thank you.
And with that, we'll
Thank you
conclude
both.
the presentation. Goodbye, everybody.
Goodbye. Take care.